Yeah.
Good afternoon, everyone. This side Dr. Bharti from BJ and Radar Opus software team. So today we are going to discuss about the topic importance of identifying missing links in case taking. So we have Dr. Sahani with us. He is going to tell us about this topic. So let me quickly introduce Dr. Sahani. Dr. Sahani is an eminent personality in homeopathy. He has done his BSc, DHMS, MD in homeopathy, PGD HHM symbiosis, PhD MUHS, and he had worked under Dr. B. Sahani, a recognized scientist and discoverer of transmission of medicine or medicine energy from hairs or distance. Then he is a former chairman, Education Committee for more than 5 years at CCH New Delhi. He served the council with developing curriculum and educational regulations in homeopathy. He is founder of Research Institute of Sahani Drug Transmission and Homeopathy and also chairman of the same. He is also professor and HOD at GD Memorial Homeopathic Medical College and Hospital in Patna. He is chief editor at Journal of Homeotransmission Patna and Homeotarang Patna. He is also a visiting professor at Homeopathic Medical College in India. He is Secretary General in Homeoscience Congress, author of many of the renowned homeopathy books. He had given live speeches at Akashvani and Doordarshan. So today sir is enlightening our knowledge on the topic of, as I have discussed earlier, importance of missing links in case taking. So Dr. Sahani, now you can continue the topic. Now I hand over to you.
Thank you, Dr. Bharti, for your nice introductions. As you told, I am a professor at the GT Memorial Homeopathic Medical College, but now I am retired now. So this is one correction I have to make. Yeah, so let me start with the topic. As you know that during the case taking, the process of case taking is very fast in homeopathy. Because why? It is only because the homeopathic we have to deal with the man. And who is the man? The man is unknown. So many things can not be understood within few hours of the case-taking process. It requires time, and with the time you have to be perseverance, and you have to follow it up. And while even after taking a detailed case-taking, what happens many a time we miss something. So I am today going to discuss about the missing link. I'm going to discuss the missing link that is there in the homeopathy. So I'm just sharing my entire screen. The thing is that the missing link in the state of health during the disease, and even during the healthy conditions, you may not be at when a patient enters to your clinic, you look at the face, you look at the things, and you have the first impression in your mind. And on the basis of that first impression, you ask some questions. And with this question, some questions are answered and some questions remain unanswered. And for that, again, you have make a investigations into it. So let me go into the slides and let me see that what are the missing, how many things where I'm trying to explain only those things which are we miss. There are many things that we can miss, and I am drawing your attention on those missing points that we have to look into the case taking. So this is the topic is missing link. Because mind is filled in with what is missing, and what is missing that we know only 7% of the humanity, 7%, and 93% of the humanity remains unknown. So exploring the unknown part of the life is very important, and with that you have to make a guesswork. You have the hypothesis you have to create in the mind. You have to but so many questions and keep on asking with us so many things. So the content of my topic is, I will be giving you the introductions, then I will be explaining you what you mean by the missing link, then understanding the missing link and nature and significance, then the concept of similimum, example of missing links, and clinical identifications of the missing link, and clinical case illustration. My main feature emphasis will be on the case demonstration and role of repertory in finding the missing links, and therapeutical and philosophical consideration, and what will be the limitation and the challenges, and then finally conclude. Now, the Samuel, you know that Samuel Hahnemann founded the homeopathy, emphasized on the dynamic understanding of the health and disease. And according to the organon of medicine, this is. And health is not only merely the absence of pathology, but the harmonious operation of the vital force reflected in emotionally stable mental clarity and physical well-being. This we all know. Disease in this context is not an entity, but the process, a dynamic arrangement. What is disease? Disease, it is nothing that you have to extract it. You have to understand. And disease means understanding, as human beings also needs understanding. Only by observing, only by listening, only by seeing, you have to apply your mind, you have to apply your intelligence, and you have to apply your emotions at the same time. So the earliest stage of disease, which are very minor deviations like behavior, mood, sensations. These are the important missing links that you can see. When the patient comes to you, sometimes you miss the behavior, sometimes you miss the mood, sensation, and these missing links are often causing the great missing link. Now, what is the missing link? Let me see. In homeopathic perspective, the term missing link can refer to various conceptual, clinical, or philosophical gap. It is a gap that prevents the complete understanding, prescription, or recovery of a case. This missing link can act as obstacle to cure or hindrance in perceiving totality, and recognizing them is essential to find the same meaning. So missing link is what is it? It is simply the gap in your understanding. The patient says something and you understand something, and between your patient saying and your listening, there is a gap. Something you miss, and many a time this usually happens that we have to look careful. So my main topic for this session is to how we are going to fill up this gap, how we are going to remove the link, missing link. Now, what are the missing links? The incomplete case taking. The first part is incomplete links. This is a major. So, and what are the incomplete case taking? That complete. What is the meaning of complete case taking? The case taking, complete case taking comes only you have taken the entire mental symptoms, entire past history, entire the family history, modality details, and the generality. So lack of mental symptoms because emotional and mental states are ignored, not explored properly, the totality remains incomplete. Then neglecting the life history, early childhood, past trauma, vaccinations, or suppressed disease may not be elicited. Then omission of the modality. How many types of the modality are there? The time modality, aggravations and ameliorations, and the thermal reactions may be missed. Then improper recording of the general, like food and desire for food, thirst, liking for the air, the constitutional picture. So there are many areas where you can miss. Then lack of the mental symptoms, neglected history, omissions of the modality details, and improper case recording. Then third part is the loss of the direction of the understanding of the miasma. Miasma is another important feature because miasma is the factor that causes the deviations, and you have to follow the path of the miasma, how it enters, how the sora entered into your life, and then how Sora became psychotic, and how the psychotic can travel. So entire traveling of the miasma facts is there. Initially the patient may be sorry, gradually he may become psychosis, and ultimately he can become. So if the practitioner fails to determine the predominant miasma, predominant means the miasma that is prevalent at that point, the time when the patient has come to you. Predominant. There may be the past miasma, but this miasma will, and if you neglect the miasma, what type of the medicines will be selected? It will not be the curative, it will only be the miasmatic. So missing link is misjudgment of the miasmatic factors that is related to the relapse. Then the fourth is failure to recognize the disease layer or suppression. Now disease, how it enters into your life? It first enters, suppose a patient is there and he has, in the early childhood, he has suffered from the skin disease. Thereafter, he get it suppressed. And after that, he started having the breathing problem. And after that, he started having the some other autoimmune disorder. So now this is the things. The autoimmune disorder developed only because of the treatment of the asthmatic condition, and asthmatic conditions came only because the suppression of the skin disease. And then again, during the treatment, the patient and doctor used to prescribe corticosteroids, surgery, or suppressive treatment that block the action of the remedy. So you have selected the medicines very properly, but because you have not recognizing the layer of the disease, and with this not recognition of the layer of the disease, you may also not identify the process of the cure. How the you may have been knowing about the Hering's law of cure and observing. So these things are often missed during the case taking. Then ignoring the vital force dynamics. Now, even during when you have understood when you have understood the symptoms, now in this symptoms is not enough, because symptoms, what is the status of the vital dynamic? What is the status level of the energy? With those symptoms, with those things, where is the vital principle? So vital dynamics is it. So vital force is the central to the homeopathy. And with this energy imbalance, you are emphasizing only on the local pathology. Suppose you are looking into a patient who is diabetic, and you are looking only at the diabetic features and not trying to look into the mental state, other physical energy level, then you may be missing the vital principles, vital dynamics. So treating pathology instead of the dynamic. This is called treating pathology instead of the dynamic. We have to remove the pathology is removed only after you remove the dynamic disturbance. So when you do it opposite, in an opposite way, like taking the care of the pathology, you will be missing the vital force. And if you take care of the vital force, you will remove the pathology also. Then inability to interpret peculiar characteristic symptoms. Now this is a very important aspect. What is the meaning of that peculiarity? It is not that what is presented in your repertory. It is not that what you, how it is different from the other person, how it is different within a person. Suppose this patient has a great liking for the sweets. Now, what happens? Great liking the food. So why how it is different from the other people? Because in the family, no one has got that so much liking. Suppose if the entire family they belong to the sweet lover, then it is not a peculiarity; it's the common symptoms. This is the things that we have to understand. So peculiarity are ignored. The symptoms selected remedy may not be truly similar. So focus on the striking singular. That is called PQRS symptoms is very important also. Then over reliance on technology and modern diagnostics. nowadays it is becoming very much fashion for the doctor to depend on the CT, MRI. Yeah, it is required. It is necessary to look into that. But correlating these CT and MRI or pathology with the symptoms is very important. And even during the CT report and MRI report, the last line you can listen, correlate clinically. Correlate clinically. And if you are unable to correlate it clinically, that will create a misunderstanding about the patient's perception. Next point is poor follow-up. Now you have selected a remedy, but proper inadequate assessment of the remedy response, like you have not understood the 12 observations, so misinterpretations of the aggravations or ameliorations or the old return of symptoms can mislead to the further prescriptions. So all these points are very important. Lack of the Hering's law of your knowledge or misjudging the follow-up. This is another. And next point is deficiency in understanding constitutions and temperament. What do you mean by the constitutions? Constitutions is not only the physical part. It is the entire personality. That includes mental, physical, emotional health. So ignoring the personality, physical traits and inheritance tendency leads to the partial treatment. Constitution has to be understood in a complete sense. So absence of the constitutional appreciation. Usually we say that calcarea carb our medicines to be fair, fat and flabby. Does it mean that this patient is suited only to the very obese and fatty people? No. It is also useful for the emaciated type of the personality. And what is the constitutional appreciation for the calcarea carb? The entire the organizational balance, equilibrium between the what is there on the body and what is there in the mind. They must correlate with each other. Next is that we have to integrate the mind, body, and spirit. What is happening in the mind, that has to be tried to be observed on the body, and it has to be correlated with the spirit. So it is a holistic emotional state, social life, spiritual distress, all are the part of the whole. So ignoring one aspect creates the therapeutic gap. So this is important things. Then remedy given without proper dose or the potency. And many a time we select the right remedy. But what happens after selecting right remedy, you have not selected the right potency. So again, this is another important missing link. So missing link, misjudgment of the pathology, potency, dose, and there is a definite law for selecting the potency. A potency is it has to be similimum with the patient's life. Potency has to be similimum. That means higher the sensitivity, higher the potency, and lower the sensitivity, lower the potency. This is the general formula. Where the mental symptoms are very prominent, you have the very clarity of the symptoms, you must go to the higher potency. In the children, because the patient is very sensitive, we have to use the higher potency. So these are the formula that is well described, and you can look into the potency selection procedure, and you must be aware about the potency selection procedure. Then many a time we try to prescribe the medicines without using the repertory, and because it takes time, and depending only on your memory, your memory is always incomplete without repertory, because no medicines can be memorized in a full sense, because each medicine represents thousands of symptoms, and no human brain can incorporate all those symptoms into the mind. We know that radar, you can go into the sulfur, simple remedy. In the Allen's Encyclopedia, 5,000 symptoms are noted. In the radar opus, you go, more than 15,000 symptoms are noted. How you can store in your mind? And if only those features of the sulfur you Have you know, by prescribing only on those symptoms of the sulfur with the misanalysis and misjudgment regarding the medicine. So following the reporterization is very important, and then going into the materia medica. So this is the entire process that we have to understand. Then your own state is also important. If a physician is emotionally involved or prejudiced or egoist or observational, suppose you are not, your mind is not there in the clinic and you are sitting before the patient, you cannot get the entire. So your own state is very important to maintain. Because in the ordinance 5 number 6 it says, unprejudiced observer. We have to be unprejudiced observer, and only an unprejudiced observer can see or perceive the patient as a whole. Then now the major Samuel Hahnemann repeatedly stressed in Organon of Medicine the need of careful, unprejudiced observations, complete totality of symptoms, and individualized dynamic treatment. So any of these gaps will definitely create, say, act as a missing link. So missing link refers to the phase of disease process where an individual begins to deviate from their constitutional state, but the changes is too subtle to be classified under conventional diagnosis. It is the gray area between the health and overt. So these are the gray area you have to look in. You have to try to practice gray area of the case. So why it is significant? Because in several reasons. It is the earliest indication, internal imbalance. It provides insight into the original cause or exciting factors. It often determines the direction of the disease that will take. You can forecast, you can see how the disease is going to do. So recognizing the link, it will help you to timely interventions of the curative medicine. Then true natural chronic disease are those that arises from the chronic miasm. We must have the understanding about this. In chronic disease, Hahnemann wrote that true and natural chronic disease are those that arises from the and latent miasmatic expressions are also often act as a missing link. You have the latent means that is not visibility. You have to, that is underlying factors. So that you have to understand properly. Then concept of the similimum. Similimum is one remedy that corresponds most closely to the totality of the symptoms, mental, emotional, physical, and the constitutional nature of the patient. So the highest ideal of the cure is rapid, gentle, and this ideal can be achieved only when we have understood the relationship of the medicines with the mental, emotional, complete portrait of the patient. And similimum acts when you prescribe the similimum medicines, it acts as a stimulus, realigning the disordered energy and closing the gap created by the disease. And then it will be able to restore the dynamic harmony, reconnect patient to the pre-disease stage, and remove suppression of or the miasma. Now, another important factor is we have to understand about the direction of cure. Follow the Herring's direction. Symptoms disappear from within outward. This is the Herring's law. From most important to the least important organ, and in reverse order of their appearance. Next part is nosodes and sarcodes. It acts as a potentized remedy and derived from the pathological and physiological substance, respectively, serve as a crucial role in addressing the gap restored. We have selected the medicines, but it is not acting. So that also requires that you must remove the obstacle by using the nosodes and sarcodes. And where to use the nosodes and sarcodes, we must have the proper understanding about that. Then the role of nosodes and sarcodes in nosodes address the hidden miasmatic plot. And nosodes are remedies prepared from the diseased tissue secretions, product of the microorganism. They are especially used in the miasmatic clearance, past infections and chronic disease, and vaccines damage or the suppressors of the nation. So in cases, if the progress is not so important, not so better, indicated remedy is not working, so a matching nosode should be. What is the meaning of the matching nosode? Matching means it doesn't mean that it has to be the 100. At least it must have some presentations in your totality. It must have, suppose you have selected 5 symptoms for the totality of the symptoms. At least 2 or 3 or 4 symptoms must have the representations of that nosode. Then only you can select the sorinum, tuberculinum, medorinum, citrinum, or any other. In past infections of the chronic disease, suppose a patient has suffered from the tuberculosis or influenza, there are the nosodes like influenzinum, carcinosinum, tuberculinum. All these can help you in treatment. Then vaccine damage, vaccinationum, there are many of the things that can be understood. And then sarcodes, restoring the function of and harmony. So the difference between the sarcode and the nosodes is that nosodes are able to remove the obstacles, and sarcodes are used to restore the harmony, the energy pattern of the case. So they are the healthy secretions or healthy organs. So it is restoring the deficient organ function, balancing the hormonal secretions, and re-establishing the physiological. And there is an intragenic origin due to the long-term hormone. And with this, you can remove this with the help of sarcodes. You can remove this. Then integrative of used to remove the missing link in case where constitutional or acute prescribing stagnates. Nosodes of sarcodes act to catalyst to vital response, unlocker of the suppressed layer, and facilitate of curative progress and modulator of the chronic internal resistance. They act as awakening the system, clear inherited tendency, and address at the obstacle to the removal. Now, clinical approach, case-based use. Just an example I am giving you, family history of tuberculosis or no current physical sign of the TB. Then missing link is the hidden miasma. Type of remedy required will be the tuberculinum. Long hormonal suppressions from steroids. The missing link is endocrine. So you will require the sarcodes, adenum, petrotinum, etc. Then patient never well since after the vaccine. So this is energetic block. You will require the nosodes or like puja or vaccinal, and frequent flu, that is lingering tendency. Relapsing fever, recurrent flu, recurrent cough and colds, weakness, so residual infections, nosodes and influenza, autoimmune disorder. So you have to use the sarcodes and where like the thyroidinum, etc. Then precaution and best practices. Use nosodes and sarcodes only after detailed case analysis. This is the precaution. And when classical prescribing stalls, avoid frequent repetition, often high potency like 200 or above in single dose are used, are followed by the observation. Do not prescribe solely on pathology. Match the symptoms, picture, modality, and general state. Use intercurrently, not as the first line unless indicated. You can use as a first line indicated, first line medicines when it is well indicated in the case. So conclusion is that nosodes and sarcodes play a critical role in removing the missing link by releasing miasmatic blockage, rejuvenate the vital force, harmonize internal dysfunctions, reactivating the natural healing process, and their judicious use based on sound homeopathic principle often helps in chronic obstinate or stalled cases where well-selected remedy fails to act. Now I am giving you some of the case. This part is very important because it is going to demonstrate about how the patient. Now, the first is incomplete case taking. A patient presented with a frequent headache, and he was earlier diagnosed as a migraine by other system of the medicines, and it was treated by the other system of the medicine. The patient suffering was severe, so we have to prescribe the medicines at earlier because the intensity was so. So during the initial case taking, we noted that pain was frontal region. It was on the frontal side of the head, and it was throbbing and coming and repeated. So on this basis, we could not explore the more regarding the mental symptoms and other detailed case history. Now, this is the failures that I am discussing about. It happened due to the hurriedness of our part, due to pressure coming from the patient side. Case was reported through our radar Opus software, considering the following symptoms: head pain, forehead, head pain pulsating, head pain neuralgic. See, I did the reporterization, and all these reports, head pain, pain accompanying by vomiting, and head congestions, forehead, and mind impatience. Only these much. So I got the belladonna and simicifuga. So belladonna was prescribed. There was some relief, but later on it again relapsed. Patient reported back after the 15 days that there was a relapse. As we felt that our case taking was incomplete, we tried to retake the cases, giving more emphasis on mental and complete cases. Now, during the new case taking, second case taking, which we took in a detailed way, we got the new insight that patient had lost his job, and he was not more anxious about his livelihood. And gradually pain started after, and he started taking painkiller as self-prescription, and also consulted some physicians who also prescribed them the painkiller. Then ever since he lost his job, he was having the sleepless nights, anxious about his livelihood. His other symptoms include their desire for the warm foods and craving for the sweets. Dreams were surrounded by water. He was an idealistic person who cannot tolerate injustice, and this was the way. This was the position because he was removed the. He saw some mistake in the company, and he tried to point it out, but the other fellow, they blame him, and he was removed. Himself was removed. So this was causing him a great distress of the mind. And with this, so now we took the following rubrics: head pain, forehead. Now this is the old symptom: head pain, pulsating, impatience, accompanied by headache, mind alienment from losing his job. Now this is a new rubrics is added: elements from losing his job, idealistic, cannot tolerate, support the injustice, and dream of water. You see, the medicines is changed, and the medicines came to is the Ignacia Amara. We prescribe in 0/3 potency by transmitting the medicines through the hair. Follow-up: after 15 days, the patient reported much relief. No other medicines was given except some placebo. Patient followed for 1 year, and there was no relapse of the symptom. Here, the missing link was the emotional layer, which was initially suppressed, ignored. You can understand that with this case, when you have not understood the nuisance, you can not cure the case properly. Now, another case, missing the or ignoring the miasmatic background. This is case number 2. A woman of 45 years was suffering from recurrent fungal infections that was known as diagnosed as the vaginal candidiasis. We are able to take the complete history and selected the remedy like sulfur calcarea through the repertorial approach, sulfur, which gave only temporary relief. We made fresh investigation and tried to see where we missed, and it was revealed that she had suffered from skin eruptions in the childhood. Childhood recalled as scabies for ointment and other medications were applied. After taking consideration, we evaluated the repertorial analysis, taking the detailed past history also, miasmatic brand. So skin eruption suppressed. The rubrics came, skin eruption suppressed, elements suppressed, complaints from family history of tuberculosis, traveling desire, mindless, female genitalia eruptions, and food and drinks, switch desire, and cold taking tendency. The medicine is there, and you can see that it is the new medicine in the emerge was the tuberculinum, which was prescribed to clear the miasmatic block. There was more relief in every area, but it soon recurred with the new symptoms. As such, we reportized it again to get the clarity, and nitric acid was emerged, which was prescribed in 0/5 potency by transmitting the medicines through the hair. Considering the suppression tubercular syphilitic miasmatic mix, we initiated the treatment with the tuberculinum, and after some time, nitric acid in a single dose cleared the eruptions completely, which never erupts even after some time. So these are the remedy that was these are the rubrics that was taken to select the nitric acid. Skin eruptions suppressed, female genitalia eruptions, cold tendency to take, mind anxiety, health about, mind fear, disease of impending, mind discourage, fat desire, switch desire, itching vagina, and itching voluptas, and itching licoria. You can see the nitric acid covering the entire picture, and this medicine was prescribed and the patient. So tuberculinum followed by the nitric acid was a true link that created the removal of the disease. And 15 days, patients reported much relief. No other medicines was given except some placebo. They followed up for 1 year, and there was no relapse. On revisiting her symptoms, it was found that she had suppressed eruptions in childhood and has a strong family history. So these things were removed now. Now the third case is that suppressed symptoms or layer. Now this is the example of the missing link. The third missing link. A patient aged 50 approached to us with the complaints of the asthma, and he was having inhaler corticosteroids for years. On the basis of presenting symptoms, we prescribed arsenic album at the initial stage without any relief, and we looked at the case, and considering the acuteness of situation, we prescribed antim-tart, which also gave relief, some relief, but it relapsed again. So this is the mistake that we have done. We realized the missing link somewhere and retake the case with more emphasis on the past and the family history. Multiple remedies like arsenicum and they were given, and but it was not getting help. So detailed cases reveal the suppression of eczema in the childhood. Allopathic, homeopathic medicines were prescribed and substituted. So we made new analysis of the case and selected the following following remedy, like respiration asthmatic, exertions aggravate, skin eruption suppressed, mind obstinate, fear alone of being, fear ghost, irritability easily, and respiration difficult midnight after 3 p.m. Sorry, 3 a.m. in the morning. Now, the medicines you can see in the here, it was the Calica. We prescribed in 0/3 potency. Patient reported with slight aggravations in respiration, but was feeling better. We continued with the same medicine. We followed the same medicines for more than 6 months. There was no relapse of eruption. We gave only placebo, and after 2 months, these eruptions will also vanished, and the patient was feeling fresh and free from respiration, experiencing new age of the life. With Calicut, the asthma improved drastically. So missing link was suppressed layer, which was not a layer of the disease, which was never addressed before. Now, coming to the case number 4, misinterpretations of the peculiar symptoms. So often we misinterpret the symptoms as peculiar, but they are only misleading one. Let us see a case. A patient reported insomnia with internal anxiety. He was taking sleeping pills, but wanted to live as dose was gradually increasing. As a routine prescription, Coffea, Nux vomica, or Passiflora were usually prescribed by the other prescriber. We took the detailed history of the patient to get the clarity of the picture, and we got the following rubrics. Sleeplessness, anxiety from sleep during. Sleeplessness, thoughts, activities of the thoughts, anxiety for the future, restlessness, night. He was a very affectionate person, so we took the affectionate. Delusion, for second, he was feeling that and delusion, he was floating. He was malicious in nature, and he had the dream of falling from the height. So the thuja was the medicines. We transmitted the thuja in 0/3 potency and asked the patient not to take the medicines. He was reluctant, but later on he understood it, and with a single dose, this patient was cured with only the thuja 0/3 potency. Now, case number 5, treating with pathology, not the patient. When you look only into the pathology and not with the patient, you cannot get the right remedy. Many a time we are lured to prescribe the pathology rubrics, but some improvement, and there are no specific cure with the problem. We as homeopaths have to treat the patient as a whole, not the pathology. Let us see this through a case. A child has a frequent cold and green nasal discharge and enlarged adenoid. This is a case of the enlarged adenoid bone. Pathological approach, antibiotics were given, and homeopathic some calibacrom, pulsatilla, hydroxys were tried based on the discharges suppressed by the other physicians. A deep dive to get the portrait of the patient, we have to take the detailed case study. And we took the following rubrics, which represented the patient as a whole. Mind, jealousy, children between. Now, this is very important that people often ignore. Excessive hyperactive children. When he was in the clinic, he was moving here and there. Mother was trying to make stand still, but it was not possible for him. General induration because the adenoid bone is an indurated bone. He was very haughty. He was shaking. He was shouting in the sleep, and then cold tendency to take, and he liked the fruits very much, and precocity. The child behaved like a very adult man. So we took the precocity in the children, and the medicines emerged through, as you can see in this repertorial chart, and a veratrum album was the medicines. It represented the complete picture. We prescribed in 5 potencies. Generally, when the symptoms similimum are there, we do not start from the 0/1 because we see the symptoms totality, and I told you the higher sensitivity and higher the totality, we go for the higher potency. That's why we started treating this patient with the 0/5 potency, and Uraja was free, and within few months, and within 3 months, the adenoid also vanished. So childhood inner emotional state was not discharged. Now, a wrong selection of the potency. Often we select right remedy, but potency are not proper. A right patient with chronic arthritis was prescribed Rustox 0/3 transmission without any relief. Medicine selected on the basis of following rubrics. The rubrics were all okay, and the patient was very much well taken. Case was there: inflammation, joint osteoarthritis, warm application, some rate, motion, beginning of motion aggravate, mind morose, fear of being poisoned, general weather, thunderstorm, dream exertions, or physical. Now, the medicines were, I told you, it was Rustox. So, initial better and aggravation. So, what we did, we prescribed, because the totality was very high. So, I prescribed with 0/8 potency, and patient recovered steadily. When the potency 0/3, which didn't work properly, was removed, and the patient was cured with that 0/8 potency. So, right potency is very also much important for this case. Now, case number 7, ignoring the vital force of the patient. For every case, we have to understand the vital force, the dynamic, and prescribe the medicines. Here we have a case of a woman presenting with the hair fall, which was treated with the phosphorus by others, and as her hair was falling in handful. During our case witnessing process, we took the detailed history, and following rubrics were emerged: mind delusion, emptiness of, emptiness sensation of, haughty, hair falling, fastidious, contemptuous, weeping anger after, mind positivity and positivity. So now he was very egoist type of the person, he haughty type of the lady, and selected rubrics that came represented the platina. Platina, depending on the totality, we prescribed in 0/5 potency. Patient gradually improved and hair stopped falling within 3 months with regeneration of the fallen hair. Now coming to the potency case number 8, it is the reporterizations. Physicians are usually in habit of prescribing remedy based on the memory. Argentum nitricum was prescribed on the basis of the anticipation of feeling and liking for the patient. This was without reporterization. Doctor felt that it is anticipation and sweet desire, so he prescribed the Argentum nitricum. But at our clinic, we observed the following rubrics: dream of falling, fear of robbers, grapes, cold drink, mind reserve, slowness, timidity, syphilis, mouth salivation, slip during, and delusion, criminal he is. So, a repertory brought a new insight of the remedy, and we prescribed the Merxol. It was transmitted in 0/3 potency, which gradually cured the case within the 3 months. Now, case number 9, ignoring the mind-body spirit. Now, this is very much important. A diabetic patient with ulcer on feet was given arsenic album, sickle core on the pathology by the other physicians without any differences. We took the case history in details, and following rubrics evolved, representing the mind-body unity. Mind materialistic, he was very materialistic in nature. Mind superstitious, and then he was forgetful of for the word for speaking. Slowness, general induration of the gland, and general skin eruptions discharging, and genitalia sexual desire excessive. You can guess the medicine, and the medicine's hidden layer was that a spiritual interest feeling is just existing. So conium mac was given and transmitted in 0/5 potency, and the things became under control within 6 months. In the last case, physician's own bias. Unprejudiced observation is required for every practitioner to develop his clinical acumen. A physician keeps giving Noxvomica to patients who complains of irritability, insomnia, and constipation, projecting their own favorite medicine. I used to see that many doctors, they keep and prescribe Noxvomica as a routine medicines in all these cases. In our clinic, we have we have protocol to follow the complete procedure, which is helpful in success in curing the sickness. A case of mental depression, 45 years old male, we followed the entire protocol of the treatment and observed the following rubrics. Sensitive to criticism, sentimental, dwells on past disagreeable occurrences, weeping is spoken when, and emotional suppress and self-control increased. Just see the medicine was Netramuroticum, which was transmitted in 0/5 potency, which gave much relief to the mental relief and gradually interest in the life. It behaved normal within 6 months of the treatment. So you can see that through all these cases, the patient become by removing the missing link, understanding I have given you 10 types of the missing link, and there may be many more. There may be many more, and you have to find it out in your case. So conclusion is that take the complete case, individualized case, understand the miasma suppression, reportize that diligently, focus on peculiar characteristic symptoms, understand the patient's inner state, not just the disease level, maintain awareness and neutrality of the physician. In homeopathy, every small details matter. Even the seemingly trivial may become missing link that unlock the cure. Now, I'm giving you some indications. The art of case taking. Detecting the missing link requires the deep listening and observations. Important clue includes subtle personality changes like dreams, fear, anxiety that deviates from the norm. Changes in the energy pattern. Previously, he was more energetic. Now he has become less energetic. Then emotional reaction to the life events. And this you have to look into it. Then mapping the events on the timeline. Then revival the initial disturbance. For example, never well since Ignatia, never well since vaccination puja, never well since suppressed eruption, sulfur, graphitis, etc. Then miasmatic understanding, the soda, poor functional disturbance and sensitivity, psychosis, overgrowth fixation, and syphilis, destruction, disintegration, etc. Next is the mental rubrics. We have to go into mind element from grief, concentration, difficult, loss of willpower, sympathetic. When you go to the mind rubrics, we have to look at the emotional state, we have to look at the intellectual state, and we have to look at the wills. So emotions, intellect, and wills constitute the entire mental rubrics. So all these three areas has to be searched for during the case taking. Then general and keynotes like reaction to the environment, reaction to the heat, reaction to the conditions, loss of the vital fluid, loss of the vitality, hot and cold remedies. All these factors are very important. Rubrics for the miasmatic guidance like skin eruptions, discharges, seal, miasma, mind suicidal disposition, syphilitic, avarice. These are the rubrics that will guide you towards the miasma. Then similimum as a resonant stimulus. Remedy does not attack the disease, it stimulates the self-healing like a tuning fork. It reestablishes the vibrational harmony. Then avoiding suppression. This is also important. Suppression deepens the gap. Remedy must be selected carefully and given in minimal dose to avoid the suppressions. Then Herrick's law and retracing. We have already discussed it, and we have to understand it and follow it properly. And then what are the limitations? As I told you during my all the case history, that first limitation is your incomplete case history, lack of patient awareness of the change, then prior suppression with allopathy or multiple remedy, difficulty in identifying constitutional picture in advanced pathology. So these are the link. And so at the end, we are coming to the end of this session. The missing link is the state of health, which is crucial concept in homeopathy that explains the transitions from subtle dysfunctions to overt pathology, and recognizing this invisible phase allows timely and effective homeopathic intervention. The similimum were selected based on the totality of symptoms, and miasmatic understanding fills the gap and restores the patient to health in a gentle and permanent way. Homeopathy thus reaffirms a dynamic, individualized, holistic system of the medicine that heals from the within. These are the references. Organon of medicines you must read. You must also go through the chronic disease. Then Kent's lectures on homeopathic philosophy. We have the Vital Cause Science of Homeopathy. Then Borix Medica. Then you can also refer to the Sankaran Soul Remedy, Hearing Guiding Symptoms of Medica, Miasmatic Prescribing by S.K. Banerjee, and one of the important books by Ortega, Notes on the Mias. All these books are available from the Bijan publications. You can get them. So mental health is often missing from public health debate, even though it's critical well-being. So with this, evolution requires intermediate form between species and palmeotology does not provide them skits. So thank you with this.
Thank you so much, sir. Thank you so much. It was so enlightening session, so knowledgeable session it was. So
because my purpose here was to address the missing link in that case. That's why I gave you only the repertorial analysis of each case and the follow-up area. This area I explained for. That's why it was possible for me to present the 10 cases this time.
No problem, sir. The query is already solved, because we just want to know what are the missing links. So you have shown that thing exactly. So that is the thing which our attendees want to know and we want to know. So you have just solved the query. You have shown the things on which we were discussing today. So thank you, sir. And thank you all attendees for listening us.